Dr. Philippa Whitlam.
Thank you very much, Mr. Bone. Let's just admit it, that before Child Smile, Scotland started with much worse teeth than children in England and Wales. Indeed, seeing people in Glasgow with no teeth at all was a common sight. Now, I was quite shocked when I attended a dental health meeting here after being elected to meet a dentist carrying a bag of children's teeth that she had removed that day, over 100 teeth. And that was the first that I realised what a difference there was in the approach in Scotland and in England and Wales. Now, there were some pilots and proposals in 2005 and 2006, but the Child Smile programme kicked off in December 2007. So we're just coming up to the end of our first decade. And it has transformed dental health in Scotland, although there's no question that we have further work to do. Overall, we've seen extractions go down by a quarter, while we've seen extractions in England over the last decade go up by a quarter. And that's something that has to be looked at. Children losing their teeth must be seen as a health failure. Now, what the Child Smile programme consists of is the core programme is that all nursery school children will undergo education and cleaning their teeth and will undergo supervised teeth cleaning every single day. As our child provision is now rolling out to 30 hours for all children, not just the children of working parents, that actually gives us access to even more children, and that includes vulnerable 2-year-olds. That's the core programme, and as was mentioned, that includes 90,000 children, and that's the main driver. But we also have the practice programme, which involves all NHS dentists in Scotland. It links with the health visitor and with the public health nurse. So if a health visitor is aware that a family are not registered with a dentist, are not active in preserving their own dental health, they can refer that child and that family to a dental health support worker who will follow the child up from the age of 3 months, who will ensure that they attend a Child Smile registered dentist. This is absolutely crucial, as we hear 80% of 1 to 2-year-olds aren't attending a dentist in England, even though the advice is they must have attended by the age of 1. The children get an annual check. Again, we hear 42% of children in 16 and 17 didn't attend a dentist. It's absolutely crucial that that changes. And what the children also access, as well as their dental check, is twice yearly fluoride varnishing, which is making a key difference. Now, what we've seen from that is we've seen Glasgow, which had absolutely the worst teeth in Scotland, probably the worst teeth in the UK, improve dramatically. Now, we still have more work to do. We still have inequality. And it is still the case that more 5-year-olds in England will be caries-free at the age of 5 than in Scotland. But what we've seen is a 50% improvement from 45% caries-free to 69. What we've seen in P7s, which is the second teeth, is a one-third improvement from 59% to 77%. The inequality is narrower, because what we hear is that 56% of children in the most deprived areas of England will have caries at the age of 5. That's more than half. That just isn't acceptable. And obviously that's something that needs to change. Now, it is important to be driving the education and to be improving dental health. But what I'm aware of is the absolute difference in the contract. And I think that's the underlying problem. Since 2006, dentists in England have been paid units of dental activity. They have 3 bands, from simple activity, such as an examination, cleaning, advice, etc., up to the complex ones at band 3. But they only get 1 payment for a band 1 unit of dental activity, no matter how much they do. So if they do examination, advice, fluoride varnishing, they will only get paid the same rate as if they only do a checkup. This means they are not rewarded for prevention, whereas our dentists are paid for doing fluoride varnishing. They are paid for doing fissure sealants. and therefore it's undermining the basic principle. We also have additional payments for children with disability, for children with learning difficulties, because we know that will take the dentist more time, and they will invest in them to try and prevent dental ill health in the future. Because we know that children, particularly with learning difficulties, have a tendency to have very poor teeth, because you can't just educate them to clean their teeth. It needs to be the people around them that commit to doing that. The other thing is the lack of registration. In England, you're not registered long-term with a dentist. So why do they invest in you? And the child is turning up and trying to get access to a dentist when they have problems. The recent articles from the BBC suggested 40% of children in England were unable to access a dentist. Well, if they're only paid the same for 1 filling or 10 fillings, that absolutely means they are not going to want to take a child who clearly already has very poor dental health. And again, there's no sense of investing in the future.
Paul Beresford.
I hear what the Honourable Lady says, and the success in Scotland has been dramatic. And the importance of the dentist is dramatic. I'd have barbs in my back if I said anything other than that, as you can imagine. But the biggest success has been the prevention program in the schools and the nurseries and so forth. That outweighs everything. That has been the reason for the Scottish success.
I thank the Honourable Gentleman for that intervention, and I was not trying to give any other impression. I said the core programme is the education of 90,000 children in how to clean their teeth, and discussions with their parents on how to clean their teeth. But the problem is that you're wasting an opportunity if you're just stopping there. You need to link up between the health visitor, the nursery, the dental practice, and certainly not to have a contract that actually punishes and penalises a dentist for investing in patients. The fact that a dentist does not have long-term registered patients means, again, they're not looking at that patient as the long-term. If I do more work now, they will have better dental health later. In Scotland, we now have 92% of the population are registered, so that's up from 2.6 million to 4.9 million. The coverage of registration is actually higher in deprived areas than in rich areas. Unfortunately, attendance is not always that way round, but they are at least already registered with a practice.
Happily. McCabe.
I'm very grateful to the Honourable Lady. She's making an excellent speech. I'm conscious this is a debate about children's oral health, but would she also accept that with the growth in the elderly population, the problem she's indicating now can only get worse if we don't have better registration and intervention because of that expanding population in the years ahead?
Dr. Philip.
I would totally agree with the Honourable Gentleman. We know that with so many areas of health, that actually the health of an adult, even an elderly adult, is actually laid down in their first 5 years. But I think that's nowhere clearer than in dental health. And therefore allowing many more older people to hang on to their teeth, to have healthy teeth, and particularly healthy gums. More tooth loss in the end is due to gum disease. So laying down those good foundations in childhood, I think, is absolutely critical. So I think registration is important. I think it gives the dentist a relationship for people who are frightened of a dentist, knowing your dentist, not being afraid of them, having access to extra support like hypnosis, etc., if that helps, is all valuable. Now, when people talk about costs, Child Smile is costing £12 million a year in Scotland into the total dental health. But it has saved £5 million in dental treatments and extractions. We heard from the Honourable Member for Birmingham Selly Oak about the money that is coming back. That could be used to set off a programme in England. Now, I welcome the pilots in 13 sites, but it's only 13 out of 23 of the worst areas in England. Why is it that the feeling of the UK government is that they need to pilot? The evidence and data is there from 10 years of Child Smile in Scotland. Just look at the data, design a national programme for England, and in the end, you won't just save money, but you'll actually save children's dental health.
Shadow